Good afternoon, everyone. Welcome to Webinar Wednesday today on January 15th. My name is Melissa Haddad, Administrative Coordinator at Digital Health Canada, and I will be your host today. I would like to begin by acknowledging the Indigenous peoples of all the lands that we are on today. While we meet on a virtual platform, I would like to take a moment to acknowledge the importance of the lands which we each call home. We gratefully acknowledge that we are on the traditional territory of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, and the Haudenosaunee, and the Wendat peoples, and is now home to many diverse First Nations, Inuit, and Métis peoples. We also acknowledge that Toronto is covered by Treaty 13, signed with Mississaugas of the Credit, and the Williams Treaties, signed with the multiple Mississaugas and Chippewa bands. Please share in the chat the territory you are joining from. Today's webinar is People, Process, and Planet, Building Sustainable Digital Health Systems. This session is part of the Webinar Wednesday Healthcare Innovation Rounds series and has been certified for Main Pro Plus credit. It is my pleasure to introduce Dr. Jessica Cuppage, is the Chief Medical Innovation Officer at Baycrest Hospital in Toronto. She is a family physician with postgraduate training in the care and the elderly and a master's degree in health informatics through the Institute of Health Policy Management and Evaluation at the University of Toronto. She is also a lecturer with the Department of Family and Community Medicine at the University of Toronto as well. Dr. Cuppage is passionate about the intersection between holistic and person-centered aging and dementia care, health technology and innovation, and building a low-carbon and climate-resilient healthcare system. Dr. Tania Tajirian is an academic hospitalist and an inaugural Chief Health Information Officer and Chief of the Hospital Medicine at CAMH. As CMIO, she has led a pioneering strategy to reduce documentation burden-inspiring national efforts in Canada. As Chief of Hospital Medicine, her research focuses on physical health, integration and advancing health informatics to improve care delivery and equitable population health. She has been recognized through multiple awards, including the 2022 Most Influential Woman in Health IT Award from Healthcare Information and Management Systems Society, HIMSS, and Women's Leaders in Digital Health Canada. Dr. Chandi Chandrasena is OntarioMD's Chief Medical Officer, providing the clinical perspective to inform digital health products and services for physicians. She plays a key role with digital health technology, clinician engagement, change management, and education, and is actively involved in provincial and national discussions in EHR integration and data interoperability. With over 20 years of specialization in comprehensive family medicine, Dr. Chandrasena deeply understands the challenges of community practice. Thank you very much, doctors, for being here today. Please note that we will have time for Q&A at the end of today's presentation, so please type in the questions in the chat at any point. I will now pass the screen over to you, Chandi.
Thank you. Thank you so much. I am going to share my screen, and this is always the test of whether you are digitally savvy or not. So let me just make sure everyone can see this. Okay, I am hoping you can see that. Can you let me know if you can't? Okay, great. And I assume you can hear me also. We are thrilled to be here today to really talk to you about building a sustainable digital health system. So you heard our introduction, so I'm not going to go into those. We have a disclosure slide because this is CME accredited. We have nothing to disclose, although I am the Chief Medical Officer of OntarioMD, which is a subsidiary of the OMA. And I will be talking about some of the programs that we offer. And to mitigate that bias is that we offer it to physicians, nurse practitioners, and community clinics free of charge. Our objectives today is really about building a sustainable digital health system. And we're going to be focusing on the importance of empowering people, optimizing process, and then aligning digital health with environmental and social sustainability. So the building blocks to sustainable digital healthcare systems are people, process, and planet. So people, this is really about cultivating trust and authentic relationships. So if you remember anything from my section, remember these 5 things. It's about people. So when we talk about workflows, efficiencies, innovations, digital tools, we're talking about health, and health is about people. And to make it work, we all have to align to a common goal. So find that common goal. The next one is trust. Trust is the key ingredient to change management and practice facilitation. So trust drives change. And patients place a high trust in their physicians for health matters. And as holders of that trust, we take that responsibility seriously. So adoption and innovation can be put on a back burner if we feel that it threatens the care of our patients, but it can also be leveraged if it helps. So we need to learn to leverage that trust. Design with users. So understand their pain points and problems and then design with them, not for them. And then the last one is that there's no magic training or change management course. One size doesn't fit all. Change management has to be done by peers and organizations that have relationships and trust that can tailor strategies to people, because it's all about people. So let's talk a little bit about the evolution of technology, right? So it started with a paper chart, a stethoscope, and a telephone. I feel like that's a great title for a song from the 80s. It also sums up my med school residency and the first 8 years of practice: a paper chart, a stethoscope, and a telescope. So around 2008 or so, EMRs were the shiny new kids on the block. And then in 2020, the pandemic accelerated adoption around telemedicine, virtual platforms, patient portals, online booking. And now we're seeing remote monitoring, wearables, and artificial intelligence. But for successful adoption, it goes beyond the technology itself. It's about the people, the trust, and the relationship. I hope you're sensing a theme here. We've learned time and time again that just developing a new and innovative technology that looks great on paper or in the lab is not going to translate into widespread adoption and transformation. So why is this? Many reasons, and we're going to talk about some of them today. But first, I just want to kind of tell you one of the reasons is this clinical digital ecosystem, and it's complicated. So this is kind of a day in my life in the community. There's a lot of piecemeal workflows, piecemeal technology, digital tools. They're not all integrated. They all don't always talk to each other. So this is a snapshot of the digital tools or processes that compete in my office for my attention currently. When you add in medicine and patients, there's not a lot of room in there for innovation and changing workflows. So understanding the reality of clinics and how they function and understanding the people, not just me as a clinician, but also the staff, everyone that makes that clinic happen, and also the patients, it's the people. And that's the key to sustainability. So goals. You have to make sure that we have a common goal if you want to make this sustainable. So in 2007, the triple aim was developed, and that was a great common goal that everyone could agree and align to: improve patient experience, reducing costs to the health system, and better outcomes. Who couldn't agree with this? But by 2014, it became very apparent that in order to achieve the triple aim, you had to address and focus on the clinician well-being. And that formed the quadruple aim, which is a goal for our health system now, and is actually a goal for a lot of healthcare processes that we have. In 2021, health equity was added, and in 2023, environmental sustainability was added, and a sextuple framework was advanced, and Dr. Cuppage is going to talk about that more later. Trust. So I want to talk to you about trust. So you may have heard of Edelman's Trust Barometer. It measures global trust across institutions, including government, business, media, NGOs, 16 countries, surveying over 15,000 respondents. And they also published a special report on trust and health. It showed that trust is a key factor in the success of digital health adoption. I don't think that's a surprise to anyone that's listening. If it is a surprise, this is a really good talk for you to listen to. So it actually showed that trust is a key factor in success. And that's trust in leadership, in the healthcare system, and the technology. And all of those are essential for fostering adoption. So how does this transfer? Well, the more trusted the leadership and technology are, the more likely that clinicians will embrace and support the change. You build trust by being transparent, empathetic, and responsive. And as healthcare professionals see tangible benefits from digital health tools, such as reducing administrative burden or improving patient care, that trust will grow and that increases the adoption. So this bar graph is from the 2024 report, and you'll notice the trust in doctors is high for health issues, and this high trust influences adoption and innovation of new technologies at the coalface. So if you ask clinics, why are they not adopting a new technology? There's many reasons that center around the patients. It's care, safety, liabilities, affecting workflow that they're not able to meet their needs. And if you notice, government and industry are a little lower on the trust scale in terms of health issues and putting priorities of patients first. So we have to start learning how to leverage that patient trust in physicians and their primary caregivers and their other clinicians for sustainable change and for co-design of better solutions. So, okay. So the 2024 report also found that trust in healthcare companies is decreasing. And there's also a sharp rise in the concern that technology will worsen healthcare. And this is impacting the acceptance of AI health innovation. And I find this extremely fascinating given that we're trying to advance more and more digital tools and technologies. And I would argue that these trends are also reflected in clinicians. So how can we foster change management and adoption? Trust in relationships. So clinicians must trust the technology, but also the people leading the change. So particularly the leadership, the IT teams, the change management specialists, and the healthcare system. There's a natural change resistance in healthcare. Often clinicians feel overwhelmed with new technology and they worry it's going to disrupt their patient care or add to their workload. So that was the quintuple aim that I talked about. They feel that it adds another layer of complexity rather than a tool that's actually going to help. There's a fear of data breaches, loss of autonomy, feeling that the tech is imposed on them, but mostly they fear about that harm to patients, to our patients. So how do we overcome that? So it's really important to understand how clinicians adopt new technology. So this is an adaptation of the Rogers diffusion curve. And this kind of outlines that the adoption of innovations follow a predictable curve to 5 distinct groups. Your innovators. So these are your I'm the first one to sign up for this and I'm going to try it. So these are the physicians who are either developing that new shiny thing or they're just about to use it because it's amazing. Small percentage. Then we have the early adopters. So these are your clinicians who are comfortable with technology and act as your opinion leaders. So you need to figure out who they are and then leverage them. Then you get to the early majorities. They're more cautious. They require evidence and social proof. Then you've got the late majority, which are your skeptical adopters who only come on board once the technology is widely accepted. And then you've got the laggards. That's the last group. The resistance is strong in this group. So why is this important to understand? Well, it's important to understand because understanding the different clinicians and clinics and where they fall in this curve helps target engagement strategies to different groups. Early adopters and peer champions are key to moving the needle with the early majority. And it's really important that we can get to that majority over that valley of death. And then to the tipping point. A lot of great innovations kind of fall in that valley of death. So how do we do this? So let's look at EMRs. How did OMD get EMRs to almost every physician, nurse practitioner, and community clinic in the province? And how do we continue to onboard digital tools successfully for about 20 years now? It's authentic relationships. It's based on empathy, support, trust, and feedback loops. So the foundation is change management and practice facilitation, but it's combined with practical experience in the community, community clinics. It's the ability to understand the pain points of these clinics and clinicians and really understand what needs to be targeted. It's matching training and technology to those pain points. It's about being able to demonstrate personal and clinical benefit for the solutions, and it's creating an environment of partnership rather than a top-down imposition. And sustainability is ensured by sharing of experiences and seeing improvements based on their input, and then that continuous tweaking and that QI, that quality improvement. So we do this on many levels. We believe in a robust vendor engagement that allows for pilots and collaborations. We have a peer leader program. We have 60 clinicians or peers, family docs, doctors, specialists, nurse practitioners, but we also have office staff and office managers. And that highlights the importance of early adopters and champions and peers talking to peers. And it really models that positive use of technology, and they also lead our education program. So we have practice advisors who have built longitudinal relationship with clinics, and they live throughout the province, and they've been supportive and responsive. We have practice enhancement consultants who are experts in digital tools and digital technology that understand the clinic pain points and workflow. They're ProSci and QI trained, and they understand the need to tailor and offer different ways to learn and understand and to build that trust. We have a robust education curriculum that includes webinars, conferences, one-on-one training, e-coaching, blogs, communities of practices, supports all of this. And then we have stakeholders and partners throughout the country. And it's really this whole intersection that gives you this bundled practice facilitation approach. So how do you jump that valley of death? You know, like if you remember that graph I showed you, how do we get there? Well, you involve clinicians early. That's the key. You engage clinicians and you involve them early, and you involve them in the co-design, the pilot phases, in the tech selection, and that allows for ownership and reduced resistance and buy-in. You focus on education that goes beyond the how and delves into the why. Why does this tool matter? How does it fit into my workflow? How is it going to benefit my patients? How is it going to benefit me? This empowers clinicians to be those advocates that you want, so they're not just users. And you need to have a forum to share those success stories. You have to provide examples of how technology has worked in similar settings. Watching a peer use a technology successfully and then tell you how it saved them time or made them a better clinician, it's gold, because that's how you create trust and that's how you create adoption. And you really need to have an opportunity for that in a manner with an organization that you trust. So you also want to provide effective, responsive support systems. Clinics need to feel that they can rely on the team for quick issue resolution and ongoing support, and then long-term engagement and commitment. So that's really trust and relationships. So the path to sustainable digital health starts with people and a common goal. So the quintuple aim provides the foundation for aligning that digital health or the healthcare's broad goals, ensuring that the tools support patients, clinicians, and care teams. Then you build trust among all stakeholders. So those are your physicians, your leadership, your peers, and that's critical for overcoming resistance. Then you have to understand the adoption process. So we talked about the Rogers curve and we talked about the Endelman's Trust Barometer. So we need to be able to tailor effective strategies for digital health integration. And then we foster continuous learning and feedback for sustainability. So that's a whole education curriculum, but that's also those touch points as you go on to make sure they're still using the digital tools that they should be using and they're still using them to their full capacity. And you have to make sure you involve the right people from the beginning. So think of digital health as a journey, one that requires not only technology integration, but also relationship building and trust development. So now I'm going to turn it over to Dr. Tania Tajirian, who's going to talk about process and use more of an acute care lens. So Tania,
Exactly.
I'm handing it over to you.
Can you hear me? Yeah,
I
thank you,
can hear
Chandi. That was amazing. So I'm going to bring the process piece, which is the building wellness into digital health implementations. Chandi, you're going to help with the slides. Next slide. So just to take you back, who remembers that very thought-provoking article from 2018 by Dr. Atul, where he spoke about why doctors hate their computers. He spoke about this ever-increasing integration of digital tools in the daily workflows of clinicians and what is the unintended consequences. So for example, EHRs. EHRs were developed to improve processes and systems and improve the patient care. But unfortunately, what happened was unintended increased in admin burden, cognitive load, and again, reduction of joy of medicine and less face time with our patients. Reminder, I'm just getting over a cold. Reminder that its documentation burden is not just the imbalance between usability and the satisfaction of the tools, but it's also the time the clinicians are spending retrieving the information, which takes a lot of effort. Next slide. So I'll give you a story of how we try to improve the process at CAMH. CAMH is Center of Addiction and Mental Health. We're the largest mental health academic organization in Canada with about 450 physicians. In 2019, we did a benchmark survey. We wanted to understand 5 years after implementing our EHR, how are we doing? At that point, we always use the mini-Z as an instrument for surveys. The burnout was 26%, but the impact of the EMR related to this burnout was 75%. We repeated the survey in 2023, which I'm going to be talking about later. So what did we do? So we knew at CAMH, next slide. We knew at CAMH that we had to develop a multi-pronged physician engagement strategy with a lot of informatics tools. So the first strategy was, how do you improve your physician's experience by rapid handling of the EHR's issue? So we developed SWAT teams. The second strategy, how do you enhance your physician's leadership and engagement? Very critical, as Chandi was talking. We developed our monthly physician think tanks. The third bucket was data and analytics. How do you leverage the back-end data? So we created divisional profiles and dashboards. Finally, how do you develop communication and education and informatics strategies to reduce this burden? So there's a lot, again, Chandi, peer education, physicians, listen to physicians. We developed monthly newsletter, physician portal, and finally, and it's a mental health organization into DMO, which is speech recognition technologies. And I love this, what I say, like we need to engage all of us to inspire working together to sustain changes in any technology that we're going to be implementing. Trust building, again, Chandi. So this is an example SWAT initiative. What do we do? Again, low barrier. We have 7 academic divisions at CAMH. We developed a multidisciplinary team, physicians, nurses, pharmacy, informatics team. We go to the group of clinicians and ask them, give us all your pain points. We categorize them. That's the SWAT round 1. SWAT 2, you will be surprised how much of it we just don't know how to use the EHR properly because they're not intuitive. And the last one is the accountability. Once we're able to solve the issues, we have to ensure that we're communicating to the clinics. Next slide. Again, this is our system of categorization with limited resources. What's all your pain point? The green, we promised we're going to fix your problems within 6 weeks. Yellow, more than 6 weeks. Blue, again, 33% from our first SWAT cycle with physicians was related to education. Items were already available, just the physicians didn't know how to use it. And finally, red, if it impacts policies, you're not going to be able to complete these changes. Next. This is the leadership informatics. This is the monthly physician think tanks over the past 6 years. It's chaired by me. But again, we have frontline physicians from every clinical division part of this think tank. And I always say it's where the clinicians are meeting the IT side. And what's the goal? Anything that touches the physician workflow has to filter through the physician think tank. Similarly, we have it for nursing and other health disciplines, but we provide that critical feedback table that it's important to develop that co-design that we were talking about earlier. And now it's not just the EHR, we're talking about AI tools. So the nice thing, if you build it, you're able to cultivate that informatics expertise and develop your future informaticians. What's the key success? I can't reiterate, it's that leadership buy-in. CAMH is quite strong believer in the importance of this issue. Leadership development where the physicians are really enjoying the work that we're doing. It's part of being proactive and solution-oriented and fixing things. And we became part of the governance structure, and that has been our biggest success. We have a shared accountability, and most of the training discussions for our physicians needs happen in the think tanks. And the nice thing at the bottom, you can see, this is the log files at the back end. We are able also to use data and analytics to measure the impact of our initiatives at the documentation burden. Next. So this is some of, again, Chandi, you said it, peer education videos, a highly respected physician, small, short videos by physicians for physicians. And again, education has always been hard. Like I find our time is so consumed with so many different things. To ask me to do additional training is difficult for all of us. Next slide. So what happened? 5 years of a physician engagement strategy. We repeated the survey. So the burnout, again, this is burnout not just for the EMR. The mini-Z showed a 28%. What about due to the EMR? Went down from 74% to 52%. Is that good enough? I don't know. I think it's good, but at least it moved the needle. What was interesting, though, next slide, that EHR challenges 5 years later is system level. So there's no quick fixes for everything in EHR. So I said chart navigation, information finding, search summarization that we all getting excited about with AI scribes, medication reconciliation, faxing prescriptions, having a longitudinal medication history, and again, system level of IT challenges. Next. The biggest success, I think this is it. So if you can see in blue, the physician think tank and the nursing and health discipline think tanks, we're part of the governance, which is, I can't say how important this is for accountability and enabling clinicians to be part of the design, implementation, and evaluation. So where are we at? I have hope in AI scribes, but again, we are the first mental health organization that we're looking at AI scribes in our environment. Next slide. And this is what, again, so critical. Don't keep bringing new tools without doing that trust building from the beginning. So we did an environmental scan with our liaisons, and it was interesting what they thought about AI scribes, which was make it clear and transparent how we're bringing AI scribes at our organization. Consent process, what's the best approaches for our patient population in mental health? Privacy, security, very important. The quality of AI tools right now is not there for mental health. But again, it's such a rapid evolving field. Bias and fairness. I really enjoyed that the discussions. Is AI going to worsen the digital divide? Is it going to amplify stereotypes and potential for hallucinations in mental health setting? Patient population, again, inpatient, outpatient, a lot of considerations we have to do. And how is it going to be linked to staff retention? Very critical at our organization. Next slide. Metrics and tracking, and I'm sure, I think all of my colleagues here, it's like the value of what we're doing. So we at our organization, our metrics, KPIs for the AI scribe is it going to reduce documentation time? Is there going to be a time saving? And again, it's very critical for clinicians, physicians, I'm going to say, don't say I'm going to save you this much time so you can see more patients. It's all about the reduction in the cognitive load. It's all about bring me back joy. I love talking with my patients face to face. And how is that going to impact my relationship with my patients? Those are very critical. And is that going to improve my retention chances at my organization? Versus, hey, you've saved so many days, let's bring more patients. So having that very thoughtful approach for KPIs is very critical. We're going to continue doing the mini-Z surveys. There's also like the professional fulfillment index, because it's not about burnout. It's what's keeping you in a meaningful way. And our patient satisfaction. Again, we're going to have a survey pre and post. Finally, I think, again, this is reimagining digital wellness at a system level. What we're doing at CAMH, we were very curious to see what's happening at the TAS and academic hospitals in Ontario. We went through an environmental scans. We interviewed 12 CMIOs at the TASN group about what are they doing for digital wellness with their initiatives. And we came out, next slide, with 5 recommendations at a system level. Again, process, right? Organizational initiatives, I can't emphasize, again, like we're seeing it very helpful at CAMH. Formation of digital health advisory committees at every organization. Creation of robust governance. Great, you can do that table, but without that governance structure, you're not able to implement changes. National initiatives, funding strategy. If you want the clinicians to be involved in digital strategies, there has to be a method for doing that. Development of a national standard toolkit. I felt every organization is doing similar things. Why are we repeating all of us doing similar things? Like, why can't we have a standardized approach? And finally, implementation of comprehensive digital curriculum, not just for our current clinicians, but our future. And we can spend an hour on that, so I'm not going to go there. Finally, I love this. We're all talking about the same thing, establishing a learning health system through digital innovation with keeping an eye, again, what's the aims of, what are we trying to do? And I love how it's going to go nicely with Jessica's sextuple. And the final slide. Okay, the 5 key points. And I think it's very important for how are you taking the process in building sustainable digital health system. Don't forget about streaming workflows, agility and adaptability as we reviewed, stakeholder engagement. Ensure that you have a data-driven optimization mechanisms. Ensure you have sustainability in the operations. A lot of these projects start and what do you do afterwards, and can't emphasize enough the importance of education and capacity building. With that, I'm gonna give it to Jessica. Go ahead, Jess.
Thanks so much. Thanks, Tania. So we are now going to switch gears a little bit, and we're going to talk about the planet side of things. Okay, so let's start at the beginning. The World Health Organization has deemed climate change the biggest health threat of the 21st century. We're already starting to experience severe climate-related events in Canada and the resulting health impacts of these. These are things like heat-related illness. The BC heat dome a few years back comes to mind. Droughts, wildfire-related asthma, COPD, cardiovascular diseases, wildfire-related evacuations. This happened in the Northwest Territories not long ago. Changes in infectious disease patterns like tick-borne diseases, and also impacts on mental health. We also know that these health impacts are going to disproportionately affect society's most vulnerable groups, including Indigenous people, racialized people, people living in poverty, people experiencing homelessness, people with disabilities, and older adults. And so really, climate change is a fundamental threat to human health and health equity and has been called the next patient safety movement. Next slide, please. So in addition to the health impacts on individuals, there are very real risks to health systems as well. Health systems can be stressed by emergencies related to climate change. There can be direct impacts on healthcare facilities related to extreme weather events, things like flooding or extreme heat. I mentioned already the infectious disease outbreaks. You can also have disruption of normal health systems operations, including the medical supply chain. Staff themselves can be impacted by these extreme weather events. And then, of course, the financial costs of climate change can't be ignored either. Rising energy costs and possible future carbon pricing programs are very real financial risks. And care quality can be disrupted for all of the reasons you see listed here as well. Next slide, please. So also we know that healthcare is part of the problem. Healthcare is a resource-intensive and polluting industry. The carbon footprint of healthcare is made up of both direct emissions, so this is from directly controlled sources on site, indirect emissions related to purchased energy, mostly electricity, and then indirect emissions related to the full medical supply chain. In Canada, healthcare accounts for roughly 4.6% of the country's total emissions, which is more than the aviation and shipping industries. And when you compare us globally, Canada is among the top emitters of healthcare greenhouse gas emissions per capita. So healthcare is a part of this problem. So what can we as digital health leaders do about it? Next slide. Okay, whenever I talk about this subject, I always like to pause and just sort of orient everybody that you are already sustainability champions. A lot of the work that you're doing every single day is very much aligned with climate conscious care. So if you can start recognizing this, if you can start viewing some of your projects through a sustainability lens, and if you can add protecting the environment to the long list of reasons to do the right thing for the patient, then, you know, I think we're taking a big step forward. Next slide, please. Okay, so here's my top 5 slide takeaways. So these are sort of the top 5 ways that you can, as digital health leaders, impact the sustainability of the healthcare system, as well as the sustainability of your own projects. So the first is using data to drive decision-making related to climate mitigation in healthcare, and I'll define that term shortly. The second is influencing clinician behavior. Digital health initiatives aimed at improving interoperability. Oh, sorry. Stay on this slide just for a moment. These can also be considered green. And then similarly, digital health initiatives targeting the upstream determinants of health or improving health access can also have environmental co-benefits. And then lastly, being a mindful consumer of health IT. Next slide, please. Okay, so just to define these terms, climate mitigation, that means trying to make the impacts of climate change less severe by preventing greenhouse gas emissions into the atmosphere, or trying to reduce the carbon impacts of what you're already doing. And then climate adaptation refers to anticipating what the effects of climate change are going to be and taking action to prevent or minimize the damage they cause. So preparing for the current and future climate realities. And for the purposes of today's talk, I'm going to focus on climate mitigation, but although there's a lot to be said about the role of data in climate adaptation as well. Next slide, please. I mean, as everybody here I'm sure knows already, using data to drive decisions is really key to making an impact, and the same is true in sustainability in healthcare. So the graphs you're seeing on the page here come from the National Health Service in the UK. So they're one of the more advanced healthcare systems when it comes to environmental sustainability. They've been tracking and reporting their carbon footprint since 2008, and in 2020 they undertook an even more comprehensive assessment of their healthcare's climate impact, which included all 3 scopes of emissions, plus patient and visitor travel. And it was verified by the Lancet at the time to be the most comprehensive and sophisticated carbon footprint assessment of any health system to date. And so these are their findings. What they found, so the pie chart shows the different contributors to their carbon footprint. And one of the biggest ones here, of course, is medicines, equipment, and other supply chain, as well as building and energy emissions. And then the other figure breaks this down by sector. And so you can see that it's a little small, the text there, but that's medicines and chemicals. And so those are a big contributor, both in primary and in acute care. So for organizations who are like very keen and they want to, let's say, achieve net zero, then of course you'll have to do at some point a measurement of your organization's carbon footprint. And there's different protocols for this. I just put an example of one there, that little stamp, the carbon neutral protocol. But I've never actually done one of these comprehensive carbon footprinting assessments myself, but from what I understand about the process, it's very labor intensive. And so the good news is, if your organization is not ready to take that on, you really don't have to in order to get started. Other people have done this. The NHS has done this. We know what the biggest contributors are. We know what those low-hanging fruit are. So, we can go ahead and get started. Next slide, please. So, yeah, measurement and reporting is crucial. And when I started looking into this whole area, I started by wanting to understand, like, where does climate related data live at my organization? And what I found was really it lives everywhere, right? So it depends on what you want to look at. So, if it's energy use or water, that might be under your facilities. Things like waste data is owned by environmental services. And, even clinical programs have data related to their use of medications, tests and procedures, and, the list goes on. So, for each organization, as they're kind of deciding what kinds of sustainability initiatives they'll want to address, they'll have to define their own KPIs as well as a governance structure to make sure that those metrics can really be tracked and actioned. Next slide, please. Okay, so let's talk about benchmarking just for a second. Benchmarking can be an important tool for helping you understand your performance, sharing best practices, and like Tania said, creating a learning health system. So I'm just going to highlight quickly, 3 levels of benchmarking that I've come across for your interest, and you can always read more about them later. But the first is a local effort in Toronto. This is spearheaded by the Tasman Hospitals, as well as the Centre for Climate, Health and Sustainable Care and the University of Toronto. And they have both a sustainability operating room scorecard, as well as a newly developed sustainability balance scorecard for organizations. And so they're using that to help the TAS and hospitals evaluate their performance and benchmark against each other. The second is a national initiative. This is the Green Hospital Scorecard. It's done by the Canadian Coalition for Green Healthcare, and it's free to participating hospitals in Canada. And they evaluate you on a number of different standardized areas. These include energy, water, waste, but also leadership, policy, and planning. And you're provided with a score for each category as well as an overall score. And then there are recognitions as well for the greenest hospital in each of these categories. So it's kind of a fun thing, you know, if you get an award for doing well. And then the last one is the Sustainability Accelerator tool. I'm not as familiar with this tool, but it is an international benchmarking tool for evaluating performance across 3 domains: environmental impact, health equity and well-being, and leadership and governance. And so you can benchmark against other hospitals internationally for participating organizations. Next slide. Okay, so I mean, number 2 on the list, clinician behavior. This is something that I'm sure is very familiar to all of you. Clinical information systems can be used to influence clinician behavior. They can guide clinicians to adhere to best practices. They can, steer towards more judicious use of tests and treatments. And so, we can design our systems to help it make doing the right thing the easiest thing for clinicians. Next slide. Okay, another topic that I'm sure all of you are working on probably day in and day out is interoperability, right? So if we can improve the communication between our systems, if we can reduce redundant testing, that also has environmental co-benefits because every single test or treatment that we order has a carbon footprint. So if we can reduce duplication or also paper waste through interoperability, these are avenues to kind of use and harness digital health to improve the sustainability of our healthcare system. Next slide, please. Okay, so this is one of my favorite topics when I'm talking about digital health and sustainability, and it's the link between healthcare access, health equity, digital solutions, and environmental sustainability. So, what I want to get across here is basically that digital tools or programs that are aimed at improving healthcare access, health equity, patient self-management, these do have environmental co-benefits, even if they're not sort of immediately obvious or easily quantifiable. So the first example here, virtual care, that can have positive impacts for people who typically experience barriers to accessing care, like rural populations, for example, and can also reduce travel and associated greenhouse gas emissions. In addition, digital tools that can empower patients to better self-manage their chronic conditions, for example, can also kind of be considered green in a sense. An ounce of prevention is worth a pound of cure. That's true here as well. So the example that I sometimes use is like trying to help a patient avoid needing a surgery is far better for the patient and also far better for the environment than trying to reduce the environmental impact of that surgery once it's needed. And then the last example here is aging in place. So, hospitals in general are quite resource intensive settings. They often have more disposable supplies than other settings. They're very energy intensive and more resource intensive in general than other settings like long-term care or the patient's home. And so new and innovative approaches enabled by digital technologies to support people to stay at home for longer and avoid hospital admission can also be thought of in a way as being sustainable because they're keeping people in these lower carbon intensity settings and out of hospital. And before we move on from this slide, it's really important here just to highlight as well the issue of the digital divide, or the difference between, the gap between who actually has access to and benefits from these digital programs and who doesn't. And, it's not the focus of this talk, but of course, health equity needs to be considered at all stages in the design and implementation of these programs as well. Next slide, please. Okay, so the last piece here is around mindful consumption of health IT. And this is another thing that I'm sure a lot of people are doing in their personal lives, right? Like we're trying to choose products that are better for the environment. We recycle, we bike to work, we do all of these things, right? Can be done in health IT as well. So the most effective step is always reduce, right? So we can consider whether, do we really need technology to solve this problem, right? Or would a people or process solution work just as well? Just because we can do something doesn't mean we should. Like, do we really need to use AI in this situation, or can we use more traditional methods that are less energy intensive? Every digital intervention that we implement also has an associated environmental impact, right? There's vast amounts of energy that are required to store and process the data that are required to generate these AI tools. There's also a lot of emissions that are inherent in the data supply chain. There are environmental impacts related to the actual building of these data centers. There's environmental harms through mineral mining and mineral production, and then of course e-waste. And improper disposal of e-waste has also been linked to negative health impacts in humans. So it really is important to be mindful about what we're going to choose. And when we do need a technology, we can ensure that energy efficiency is prioritized. And then when it comes to things like, reusing, repurposing, so again, asking ourselves, like, can we, for example, replace a part of a hardware instead of the entire device? That could extend its life. Could we, repurpose a hardware from one program to another? And then when, health technology does reach the end of its life cycle, there are secure e-waste recycling services that are also certified. So they will reuse any parts of the technology that they're able to, and then anything that they're not able to recycle or reuse, not able to reuse, they will recycle. So another really important way that we as digital health leaders can really make an impact. Next slide, please. Okay, so I'll just spend a moment on conclusion here before we jump into the Q&A. So next slide. Calling back to Chandi's earlier slide, the path to sustainable digital health really starts with that foundation of trust, right? And having the trust with your stakeholders, but also having an aligned goal. And I didn't pull up the sextuple aim, but it's mentioned here. So in addition to all the other quality aspects that we want to focus on, environmental impact needs to be considered. And you can kind of start to view your digital health initiatives through a bit of this sustainability lens. So how can we think about what we're doing as improving the sustainability of healthcare, and what are the potential unintended consequences or harms that we need to consider as well about our programs? And once you build on that foundation, then you can kind of get into more of your tailored adoption strategies and creating that learning health system for continuous feedback. So this kind of sums up our talk. Next slide. It's all about the people, cultivating trust and authentic relationships, the process, building wellness into your digital health implementation, and the planet, making sure that, we focus on building a truly sustainable digital health system, which really should consider the environmental impacts of what we're doing as well. Thank you, and we'd be happy to take any questions.
Thank you very much. That was very informative, and I actually learned stuff, and this is not my realm, so thank you. We have one question thus far, and I will read it. To what extent are the learnings from CAMH experience being migrated formally to the health system generally in Ontario or into national landscape? And if they are, how is this happening?
So that's the academic piece, Donald. And every step of everything we've done throughout our journey, we've been heavily publishing and going through conferences, presentations, talking with people, having those lovely CMIO tables, I call it. So I must say, bits and pieces of the engagement strategy. And again, you have to develop what's suitable for your organization, is being taken. And the other thing that we've done was we made it as the physician engagement strategy became a leading practice for HSO. So this has been enabling us to be able to turn to other organizations and say, hey, this is why this is human-centric and is effective of engagement. The other thing is, again, when you talk about, I love this, like Chandi, how to get into the system, right? Like how can I make changes? It's a very complicated question. But again, like it's like you start small, but I'm hopeful. Similarly, as in the states for documentation burden, they're like AMIA, the American Medical Informatics Association, they've done a great initiative, which is reduction in 5 years, 25% of documentation burden. So there is that. We're hopeful. Like I said, like, can we have a standardized toolkit that Canadians can use? These are the things that we're thinking about next.
Thank you. And Joseph asks, how does data quality integrate into process considering the physician engagement strategy and EHR system?
Okay, so there's log files at the back end. Everything you do with all of the EMRs, everything is being measured, right? So I always kind of say to organization, do you have the capacity to look at that? So for us, for example, that's what I'm doing. We're able to measure the time that our psychiatrists are using compared to other psychiatrists in the States, right? But again, and even within our CAMH, we have 7 different clinical departments. So we're trying to have a customized dashboard, because as a hospitalist right now, if one of my, I'm the chief of hospitalists, if I have a hospitalist who's burning out from EMR, I'm able to see if they're documenting pajama time at like 1 o'clock in the morning, 2 o'clock. So there are tools, but you have to, again, the accuracy, which we did do a study on it and showed the variability. So developing that trust is critical. So the first time we showed the log files in our think tank, physicians where this is inaccurate, how are we checking validity? So there's all of these pieces. It's taking us years to build the trust, even in the backend data. I hope that answers your question.
Thank you. Do we have any more questions? Give it another second or two.
I'm still shocked that we kept it under 1 hour.
You did very well. I was watching the clock.
That's okay.
Donald, this is an excellent initiative, and necessarily it has a strong focus on health system and provider functionality. What efforts are being made to place the patient at core and providing them with access to all of their health record and information in the I never get that word right.
Don't worry.
Interoperable fashion without having them access siloed sources?
It's the portals. We can spend an hour talking about the usability of portals, but we do have at CAMH, our patients are able to log on to the portals, and we're going through an update right now. Chandi or Jessica, do you want to answer that? Like it's how do our patients access their information?
Yeah, I don't have a whole lot more to add. I think it's a general sort of trend towards offering that immediate access, and that's what patients want, and it is their own data. So efforts are being made to enable that, I know, in various places, including portals.
Yeah.
What about the community, Chandi? The community?
Yeah. So it's not there yet. I think everybody knows that, right? But it is definitely a priority. And so in terms of getting that data out into some sort of platform or portal that patients could access. So individual hospitals have My Chart or a version of that to look at their data, but the bulk of your data is actually in primary care. It's in our EMRs in the community. And so really it's like, well, how do you get that out to be used so that, you could follow a patient on their journey of care, and especially, and not only within your province, but also when you go from province to province, right? And so there's a lot of organizations nationally that's been looking at this. Canadian Medical Association, we just finished a task force and a report about digital interoperability, and what that could look like and what the barriers are and what the challenges are and how do we go about doing that. I know Canada Health Infoway has been doing a lot of work looking at that interoperability piece about getting access for data for patients. And then each province has their own projects that are underway. So Ontario Health right now is working on patient summary, Ontario patient summary, whereas Canada Health Infoway is looking at a Canadian patient summary, which is modeled on the international patient summary. But essentially that work is happening and we're starting to connect those dots. And we're looking at the processes and the tools and what needs to happen for that to occur. And you know what's the slowest part of? Yes, we need to figure out the interoperability because our systems don't talk to each other. But a slow part is that trust and that people, because data is about people, and all this data is in different systems, in different kind of environments. And there's a lot of data governance, data liability, kind of fears, challenges. And that's what is taking a lot of time, is navigating that trust piece. Not a great answer because I don't have a solution, but it's definitely happening and it's accelerating the last little bit.
I'll make time for one more question, but I need it to be a little quick on the answer, just in time. How are patients fit into the design and changes being made? Are there patient-centered service designs, engagement principles that influence the changes?
I'm going to say this is the passion that I have with the other role, which is population health. Again, I think EMRs, all of these digital tools will have to understand the frustration. We're just adding documentation and we have no idea how this is really helping our patient care. So the whole thing about moving towards data analytics, population health is the exciting part. So for example, my hospitalist team, we're involved heavily in quality informatics initiatives with that EDI lens for cancer screening. Our patients with severe mental illness do not go through their cancer screening. So we've been working with them. What's the education we need to do? What's the barriers? What's the facilitators? So there is so much you can do in digital health to improve care that, again, we just need to figure out, fix the problems, and then start having the valuable work that's coming up. But right now it's not there. I can't even screen my patients without doing a data pull and all of that. But it's coming.
Thank you again. That is wonderful. So we're going to wrap up, and I'm going to launch a poll, and I ask for everyone's feedback. It definitely helps us bring more of this type of content, and we always want to make sure that that we stay on what's relevant. So thank you.
Do we fill it ourselves?
No.
I got it. That's fine.
But I appreciate the eagerness on that. Just a couple more moments.
And we're more than happy if anyone wants to contact us individually.
You can probably put your email in the chat, and then they can copy it while I wrap up the rest of it. Thank you very much for sharing, for giving me that feedback. This is being recorded. This webinar is being recorded, and we encourage all of our members to log in and join or start a discussion on our community. All Webinar Wednesday recordings, including this one, is located on our community, and you can be able to view it on there. And upcoming events. We have a number of upcoming events in February, and eHealth is in June. Registration has recently opened for eHealth 2025. It is our 25th anniversary, so we do encourage everybody to join. Register now before early bird registrations close at the end of February. I thank you again for everybody for being here today and providing us with some amazing content. Thank you so very much. Have a great day, everyone.